Well, a new study finds the past few years has already been compounding a dire problem in the healthcare industry. We're talking about burnout, stressed out, overworked doctors. The survey reveals the burnout physicians are experiencing is affecting the quality of care they're giving to patients. Nurses have been sounding the alarm on this for a couple of years now. More than half of physicians 55 and older say they will stop seeing patients over the next 3 years. Joining me right now to talk about the findings, Dr. David Blumenthal, the president of the Commonwealth Fund, the national organization that conducted this survey. So first of all, good morning. And second, why are we still seeing burnout in the medical community at the levels we are?
Well, I think in the primary care community, there's always been a high level of stress because primary care is undersupplied and undercompensated. But that has not been as much true in the international community, where I think COVID has been the major factor. Interestingly, the United States, though burnout is a big problem, is about average across the 10 countries that we survey. And I think that speaks to the fact that actually in other countries, primary care physicians have played a much bigger role in managing COVID than they have in the United States.
According to the study, nearly 2/3 of young clinicians reported higher rates of emotional distress. So what do you think needs to change in the industry?
Well, primary care physicians need to be rewarded more for the very hard work they do. They need to be supported with more behavioral health, mental health services. They need to be integrated into groups where the responsibility and the demands for care can be distributed across colleagues and across nurse practitioners and other kinds of healthcare aides. So they need to be protected against the onslaught that faces them not only daily in their work, but also during the pandemic.
What will happen once the older physicians leave, this generational transition out of healthcare?
Yeah, well, that's a real concern. The United States does not have enough primary care physicians. We can't afford to lose nearly half of our older physician, our experienced, mature physician workforce. We really have to make it attractive for those older physicians to stay in some way in the workforce, maybe not full-time, maybe part-time, but rewarded for that incredibly important work that they do, for the experience they've accumulated over a lifetime of seeing whoever comes into their offices and providing the point of entry for preventive care, for acute care in our healthcare system.
This is a multifaceted problem. A lot of people obviously need to work together on this. What do you think the federal government needs to do?
The federal government needs to support the training of primary care physicians more generously so that we have a larger supply. They need to increase the funding for primary care physicians who are deeply undercompensated compared to their specialty colleagues. And they need to pioneer new forms of primary care service that are more forgiving and more supportive for physicians who live on a hamster wheel of constantly seeing patients every 15 minutes, all day long, every day.
And one more question for you. Obviously, some of this is on the actual person themselves to prioritize some self-care, to perhaps go and seek their own medical attention should they need it, or mental health attention. What would you give as advice to physicians who need to prioritize that self-care?
Care for yourself. You cannot be good for your patients. You cannot be at your peak for your patients if you are stressed, burned out, overtired, worrying about your children at home, worrying about your older mother or father. You need a village. Primary care physicians need a village to make them feel comfortable and rewarded in their daily work.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.